Good afternoon to everybody. In the study that I'm going to present, we would like to identify distinct cognitive phenotypes in multiple sclerosis. Cognitive impairment affects from 40 to 70% of multiple sclerosis patients. It can alter behavior and quality of life of MS patients. Information processing speed and episodic memory of the cognitive function more frequently involved in MS. MRI is proven to represent a powerful tool in investigating the neuroanatomical substrates of cognitive impairment in MS patients, however, leads to sometimes conflicting results. In this perspective, different substrates have been identified in details. These neuroanatomical substrates of cognitive impairment include white matter lesions, white matter microstructural damage, gray matter lesions, gray matter atrophy, and abnormal pattern on cerebral activation. However, the lacking of such a specific characterization of cognitive deficit at patient level may hamper an accurate definition of the neuroanatomical basis of cognitive features, as well as the development of tailored rehabilitative strategies. Against this background, a promising approach to achieve the personalization required is to identify cognitively homogeneous subgroup of patients, which may be defined as cognitive phenotypes. To this aim, we would like to identify different cognitive phenotypes in MS patients embracing the full spectrum of disease. We would like to characterize their clinical and MRI features. In the study, we enrolled 1,212 multiple sclerosis patients and 196 age, sex, and education matched healthy controls. Patients underwent a neurological examination, and both patients and healthy controls underwent a neuropsychological assessment. A subgroup of the study subjects, including 172 MS patients and 50 healthy controls, also underwent to 3 Tesla examinations. We obtained measurement of T2 hyperintensity lesion volume and a quantification normalized brain volume, white matter, and gray matter volume. We also performed a deep gray matter segmentation by using the software first. For the statistical analysis, in order to identify cognitive profiles defined as cognitive phenotypes, we perform latent profile analysis of cognitive test data score. After defining the optimal number of profiles, we also perform between group comparison on clinical, demographic, and MRI parameters of each cognitive profiles. In this table, you can see summarized the main clinical and demographic features of the study subjects. In this graph, you can see reported the profiles obtained. We identified 5 different cognitive phenotypes that we named as preserved cognition, mild verbal memory, semantic fluency, mild multi-domain, severe executive attention, and severe multi-domain. In this graph, you can see summarized the main between group comparisons across the different phenotypes. As you can observe, preserved cognition, mild verbal memory, and semantic fluency patients were younger and had shorter disease duration. Preserved cognition also had lower clinical disability, while severe multi-domain patients had the highest clinical disability. Severe multi-domain patients also had the highest levels of depression, and while severe executive attention patients had the highest level of fatigue. When we observe the distribution of cognitive phenotypes across the clinical one, we can observe that more severe phenotypes are more frequent in progressive patients, while primary progressive multiple sclerosis patients had a peculiar distribution of the cognitive phenotypes, and we can observe a prevalence of mild impaired phenotypes. In this slide, you can see summarized the distinguishing MRI feature of each cognitive phenotypes in red or in yellow. In yellow, you can observe the comparison versus healthy controls, while in red, you can observe the comparison versus both healthy controls and preserved cognition patients. As you can observe, preserved cognition patients only experience a reduced thalamic volume when compared to healthy controls. Mild verbal memory semantic fluency patients were characterized by lower hippocampal volume, mild multi-domain patients by lower neocortical volume, severe executive attention patients were characterized by higher tissue region volume, where severe multi-domain patients were characterized by broader pattern of the atrophy. So in conclusion, by using a complete neuropsychological evaluation in a large and heterogeneous cohort of multiple sclerosis patients, we were able to identify 5 homogeneous cognitive phenotypes. We confirmed that cognitive impairment occurs since from the early stages of disease, and that more severe phenotypes are more frequent in progressive patients. Furthermore, we were able to describe separate underlying neuroanatomical substrates, thus supporting our data-driven findings with a biological basis. Finally, by defining cognitively homogeneous groups, this classification can be useful for future research on cognitive impairment in MS and for defining personalized treatment and rehabilitative strategies in the clinical practice. Thank you for your attention.